for coming. I know it's fairly thin right now. We've got some pretty good competition from some other programs. I'm Joe Petelin. I'm a private practice surgeon in the Kansas City area. This session is entitled Lessons Learned from the Private Practice. And we've got what I consider to be a very good group of physicians, surgeons to talk to you about what we've learned. And we've divided it up into what happens in the outpatient clinic, what sort of electronics are coming our way and what can help us to be more efficient. Then what happens in the operating room, and then finally after all of that, how are we going to get paid, if we're going to get paid, and what sort of new things are coming down the line. So again, we've selected these speakers based on their particular expertise. When Dr. Unger, my co-chair, and I first got this assignment, we both, when we were talking to each other, both said, we're going to do what? As it turns out, we feel that this is as important a topic as all of the other quote-unquote scientific topics, because our world has changed from just being concerned about what happens in surgery and what we do, why we do it, and when we do it, into what it's going to change into is we got to encompass the whole thing, because with the accountable care organizations, we're going to be involved in that whole pie. So hopefully this will give you all some information, and hopefully we can have some good question and answers after we're finished lecturing. So without further ado, I'd like to call my co-chair to the podium, Dr. Steve Unger, who is at Mount Sinai in Miami Beach. He's been in private practice for at least as many years as I have. He's going to talk to us about strategies for efficiency in the outpatient clinic. Steve?
To begin with, I have no disclosures. Again, Joe and I talk like, why are we giving this talk? And I want to thank all of you who are here, who I can count on two hands for coming. For years, and I was in SAGES from the very beginning of the organization, I was looked upon as the guy in private practice. And when I served on the board of SAGES, it was sort of a unique bent coming from private practice, because a lot of the people in leadership were in the academic setting, and there were issues that were of concern to us that were not of concern to them. And the example I remember the best was in the early 90s when in Miami the HMOs decided to give endoscopy to the gastroenterologist by capitation contracts. I made an emergency trip to the board meeting, and I wasn't planning to go. I remember my wife got me a ticket. The only ticket left was a first-class ticket, and it was shocking to me that the Board of SAGES at that time didn't recognize how serious a problem it was that we could be economically squeezed out of an entire part of our discipline, and also something we love to do just by a stroke of the pen. And so what we've had to do is learn how to be much more nimble about that kind of thing. Also, before I go through this talk, I wanted to give a shout out to my wife, who's in the back of the room, who, while I was a medical student at Duke, was serving as an accountant for Blue Cross and Blue Shield, and so has a unique perspective on how to deal with insurance companies, and has set up at least the business side of our office on a very efficient basis, which leaves me just the medical side to deal with. I also, from the time my kids, who are all grown now, my oldest is about to become a surgeon, finishing his chief residency, but from age 14 on, while they were in their high school years, whenever they had a free holiday, we put them to work in the office running patients from the waiting room to the exam rooms. And my daughter would kick me in the rear end and say, "Come on, Dad, pick it up. You're not going fast enough." And so we've had family involvement there, and it always is centered around the efficiency of the office. I looked at first the efficiency of the waiting room. There's actually articles written about how important the waiting room is to the efficiency of your office. Make it pleasant. Consider distractive options. The last thing you want to do is have a disgruntled patient who's been sitting in a stuffy waiting room with a bunch of sick people. Suggestions or distractive options like a television on a low volume, a fish tank, plants, music, prepare your patients. But I think the most important thing is avoid making your patients wait. There really is no need for it, and a lot of people schedule poorly and have patients wait. So most of us now have an electronic record, at least for the business management side of our office. We're all adopting it within the next few years for the rest of the office. But use your schedule correctly, and in our office we make different time slots for different patients. So we wouldn't have like 4 new patients come in at the same time. We know they're going to take at least 10 to 15 minutes, and so they are scheduled into the schedule as a new patient visit, and the time allotted to a new patient is given to them. And the same thing is true of post-operative patients. I can bang through 6 or 7 follow-up hernias in 10 minutes, and so they don't need to have as long a time. But if you schedule them without remembering what they're there for, then there is going to be waiting, and there is going to be difficulty of a backup of the schedule. And every one of us gets a call from a fellow physician during the day. Can you see so-and-so? They've got excruciating pain. They have a hernia, which may mean that they just want to go out of town and they have to be seen that day. But where do you put those patients who you add into the schedule, or somebody has an abscess that needs to be drained, or a patient with a bellyache that you need to decide how serious a workup they need? We actually have slots on our computer schedule that are called Unger spots, and my office has to ask me, can I stick someone in an Unger spot? I say, how's the schedule going? They say, not bad. Okay, they can have that slot. Or if not, we tell the patient, come towards the end of the schedule. You may have to wait a little bit, but at least we won't keep the patients who are scheduled for office visits waiting, so that they then become disgruntled. I think a lot of the discussion that's going to follow the efficiency of the office visit is going to be moot, or at least included in the electronic medical record. And the reason for that is that hopefully when we have the electronic medical record in all offices and in all hospitals, and by the current legislation they will be able to talk to each other, that a lot of the information, such as labs, x-rays, and other pre-visit consults, will become part of your record automatically. That's not going to happen right away, but eventually it will. But as of today, if you're going to be efficient in your office staff has to accumulate that data before the patient gets into the office room. If you're wasting time calling for a consult, calling for an x-ray report, or calling for a lab result, you've really put yourself in a bad place in terms of running a continuously efficient office. And one of the suggestions actually from the literature on this particular subject is, if you do have multiple doctors in your office, consider non-traditional schedules that keep the doctors from overlapping one another. And for my own office staff, in terms of a non-traditional schedule, we used to run the office 9 to 5. And in Miami, rush hour going north and south is really bad at 5 o'clock. And so my office staff said, could we come in at 8 and go home at 4? It really would make a difference to our day. And I looked at when I see patients and how that worked with my schedule. And I said, yeah, you know what, that's a benefit. And it turns out by just shifting the schedule 1 hour with the particular traffic patterns in Miami, for all my office staff, it was like I gave them a present of an extra hour a day that they didn't have to spend sitting in a car. Improving the efficiency of the office for the preoperative visit, and there are really good studies about this particular issue, and it's multi-pronged. It's educating the patients, educating your staff, and making sure that you have an intelligent staff. And it's very important also that you confirm all of your appointments ahead of time. So it's not wasting manpower to have someone call everybody the day before and make sure that they're going to come to your office, because an empty spot is lost income, obviously. And if it's somebody who just forgot about it, they are going to have to be added to another day. So you've not only lost the visit for that day, but you've wasted or added a spot to another day and made another day more difficult. I think probably the most important thing in an efficient office is staff. And I know my accountant tells me that for pension reasons, it's better to have really young people working for you because they can be somehow written out of pension plans, and it's better to have entry-level people because you can pay them a lower salary. I beg to differ with him from a philosophical standpoint. I think you have to surround yourself with smart people, efficient people, and courteous people. Educate them as best as you can and make it so they can't afford to leave you. And we usually retire our staff after 30 years in practice. Wouldn't surprise me. And I have many members of my clerical staff who tell me, I'm working until you retire, Dr. Unger. And that's really what you want. There's actually a literature on the architecture of the office and efficiency. So number one, if you have the opportunity to design an office space, and I've done that twice in my career, design it so like you design a kitchen. And I don't know if you know about work triangles in a kitchen, but you don't want to have to go very far between your refrigerator, your counter space, and your stovetop. And the same thing is true in an office setting. So look, when you're designing an office, at the flow of the office. You don't want to have patients and staff crisscrossing each other. You don't want to have bottlenecks. The ideal is they come in at one point by the waiting room, make a circle through the exam room, and go out a checkout place in another direction. That doesn't always work, but if you had the ideal space and could design it that way, that would be great. We try to avoid having families come into the room and spend time in the common area of the office. That's really what the waiting room is for. And if we need to speak to a family, we bring them in the room with the patient. And when the patient is done, they either go into a scheduling room for a private conversation with our scheduler, or they wait in the waiting room while we process the patient for whatever needs to be done. But because of HIPAA and privacy and just congestion in the office, it's not a good idea to have groups of people standing around. We try to have financial discussions with the patients either by phone or before their follow-up visit. Again, the last thing you want to do is be arguing about a copay through the window of the waiting room with your receptionist. Try to have those discussions ahead of time, and then the patient knows to take care of the financial part of the equation at the time that they show up. And then we'll talk a tiny bit about this more, but set up your rooms identically. The last thing you would do is be looking for things differently in different rooms. If you have an existing space, and this is sort of an important point, and you need to make it bigger, it's too crowded. There are things that we take for granted, but you don't think about. Swinging doors occupy space, so pocket doors are better for space saving. Sinks take up space. All you need to do is wash your hands usually, so you just need a little tiny sink. Cabinetry does not have to be like standard kitchen cabinetry. It can be very shallow. If you don't have room for a surface for your, we're all going to have laptops or tablets in the near future. An articulating arm with a little desk surface will suffice for that. And in the old days, as you know, the standard was waiting room, exam room, then come meet with the doctor in the consultation room. That pattern really has disappeared from the practice of most modern surgeons. So consider, if you have multiple consultation rooms for multiple doctors in an office, repurposing those consultation rooms as exam rooms. These are just a few little pearls. Obviously, standardized room. I could take this picture in any of the three exam rooms in my office, and every single one of them has the shelves set up exactly the same way. So the gloves are in one place, the gauze in another place, tapes in another place, and it's exactly the same in each of my rooms. This is a small point, but I can't tell you how much time it saves my staff. Alphabetize your piles, and if you look here, it starts with A on the left, goes down, and the last one is at the end of the alphabet. We don't put down a chart in the office without putting it into an alphabetical pile, and we don't put piles of signed and acknowledged reports just in a pile. Those go into a file organizer until they're put into the chart by alphabet. So if a chart is missing, you just look at the pile, not at Z, not at X, whatever the name is, and move on to the next place where you might find a chart. And then consider, this is a suggestion of one of my colleagues, but in terms of efficiency and economy, consider doing the little things that you might do in the hospital in your office. I don't do this because of the nature of my practice. My office is really too busy to start doing procedures in the office, but many of the insurance carriers will reimburse more for procedures done in your office instead of in the hospital, and those require no preoperative workup, no approvals usually, and will reimburse higher. So in conclusion, my conclusion is actually going to be with the audience. I'm very interested to hear the tricks that you have in your offices to make your offices more efficient, but there are many areas of the office setting that can be made more efficient. Our rules and regulations that we fly by are moving targets. You have to be nimble enough to respond to each of these changes. The electronic medical record may help, I think it will help eventually, to maximize our efficiency. And try to make your office a pleasant and efficient place to work. It'll make you a happy person, and I know you're going to practice more efficiently if you're happy.